For the intracoronal bleaching of endodontically treated tooth, meron tayong two method na usually ginagawa. It is, ang una ay walking bleach, and pangalawa is the thermocatalytic technique. For the walking bleach technique, sodium perborate ang common na ginagamit as bleaching agent. And lalagyan muna natin ng calcium hydroxide, deepest pa doon sa ating CEJ or near doon sa ating gutta perca dahil endodontically treated tooth na siya. Para lang iseal at hindi pumasok yung bleaching agent doon sa ating apical portion. So, required si patient bumalik weekly para palitan or ma-check kung na-achieve na ba yung results na gusto nating i-attain. And then, if composite restoration ay nag-discolored siya, nire-require na magkaroon na external bleaching. And for the in-office non-vital bleaching technique, we have thermocatalytic technique. In thermocatalytic technique, it uses 30 to 35% hydrogen peroxide in liquid sa pulp chamber. So, after nun, gumagamit ng heat application using an electric heating device. Hindi naman siya usually or hindi na siya common ginagamit dahil nagkakaroon ng potential cervical resorption dahil doon sa heating process. Meron din mga journal reports na nagsasabi na may isang technique na pwedeng gamitin which is the ultraviolet photooxidation na kung saan mayroong 30 to 35% of hydrogen peroxide on the pulp chamber. And then, pag-a-apply nun, gagamitan naman ng ultraviolet light doon sa labial surface ng ipin. Yung bleaching procedure niya, manggagaling siya intracoronally. Hindi lang siya external. Okay. So, adverse effects of bleaching agents or bleaching procedure on an endodontically treated tooth. So, pwede magkaroon ng external root resorption, chemical burns, sa kadahilanan na pwedeng hindi fully sealed yung ating intracoronal filling, na kung saan pwedeng mag-seep in yung chemicals palabas sa apical foramen, and pwede nga yung maka-irritate doon sa surroundings ng ating ipin. So, inhibition of resin polymerization and bonding strength. So, for the restoration of endodontically treated tooth, dapat magpalipas muna tayo ng 7 to 14 days after the bleaching procedure para mabigyan pa natin ng time yung ipin na if magkakaroon pa ba siya ng changes after that procedure. Kasi nga, diba, dehydrated si enamel surface. Ngayon, after enough days, re-rehydrate na ulit si enamel, and then lalabas na ngayon kung ano yung tunay na shade na kinalabasan ng ating bleaching procedure. So, dapat daw ay gumamit tayo ng lighter shade na light-cured acid-etched composite resin sa ating restoration. Dapat sinasuggest din na maglagay tayo ng white cement under or beneath that composite so that hindi lang translucent or hindi maging translucent yung magiging kulay ng ating composite, kundi pwede nating ma-match si composite or si final restoration doon sa final product ng ating bleaching procedure.
Okay. For our journal, yung topic namin is about bleaching of non-vital teeth, 5-year follow-up case reports.
Introduction. Tooth dyschromias constitute a clinically visible deviation from the normal dental contour. So this creates an aesthetic problem that become a great concern sa mga patients. So they are classified as either intrinsic tsaka extrinsic. Sa intrinsic, yung sa mga drugs, iatrogenic factors, sa aging, tsaka traumatic factors. While sa extrinsic naman, affect the external surfaces of the teeth and may be results of habit, diet, or both. Dental bleaching is one of the alternatives used today to improve the aesthetics of discolored teeth. So it is considered a conservative clinical approach where yung chemical solution or yung bleaching agent is applied sa surface of the interior tooth. This procedure involves placement of chemical oxidizing agent within the interior portion of the tooth to remove the discoloration. So meron dalawang bleaching agent na ginamit, yung sodium perborate or perboric acid, tsaka carbamide peroxide or urea peroxide. So, yung sodium perborate, most trusted among dentists for use as an internal bleaching agent. While naman yung carbamide peroxide, most widely used siya sa dentistry for external dental bleaching. Materials and methods. So, merong 45 volunteer patients participated in this study, pero 13 patients lang met the requirements to participate in this study. Pero merong isang patient na 2 beses siya na root canal, so counted din siya in making a total of 15 treatments. Their chief complaint was the presence of tooth with a darker shade than that of their other teeth. So all of the patients revealed a history of dental trauma and were diagnosed with non-vital teeth with traumatic dyschromias. The 15 teeth to be treated were divided into 3 groups. Group A, Group B, tsaka Group C. Sa Group A, sodium perborate plus distilled water. Tapos nag-change siya every 7 days with a total of 3 to 4 sessions. Sa Group B naman, 37% carbamide peroxide gel and change every 7 days with a total of 3 to 4 sessions. Sa Group C naman, 37% carbamide peroxide gel and change every 4 days with a total of 3 to 4 sessions. Bleaching technique protocol. So una, diagnosis and treatment planning. And then oral prophylaxis para ma-register yung initial tooth color according to the Vital Color Guide. Tapos tooth isolation to protect the adjacent structures from the bleaching agent. Then reshaping of access cavities so pulp horns or other hidden areas can be properly exposed and cleaned. So para ma-generate yung space for the application ng cervical sealed material, tsaka ma-expose yung dentinal tubules for the application ng bleaching agent. So sunod, reduction of root filling, 3 mm apical direction from clinical crown height, tas application of mechanical cervical seal in the form of a 1 mm coltosol cap with a layer of light curing glass ionomer cement placed upon it para minimize yung leakage of the bleaching agent. Sunod, acid conditioning with 37% phosphoric acid for 30 seconds para ma-remove yung smear layer and to open the dentinal tubules. Then, application of bleaching agent. Sa Group A, sodium perborate was triturated sa glass slab and distilled water was added. Sa Group B and C naman, 37% carbamide peroxide gel was applied to the pulp chamber without touching sides to restore the lingual access. And then temporary filling with coltosol, and lastly, occlusal adjustment. Follow-up appointments. Each treated tooth was evaluated and the results were recorded according to the Vital Color Guide. And then the teeth were photographed to capture the sequence of color changes. When the tooth reached the desired color or bleaching limit, the temporary filling was removed and pulp chamber was irrigated with water to eliminate the bleaching agent. This process is necessary for groups B and C to allow for the placement of calcium hydroxide, paste, and water, which remain there for 10 days to neutralize pH. After 10 days, the calcium hydroxide was removed and then proceeded to the final restoration of composite by incremental technique and with care taken to prevent premature occlusal contact.
So results, 5-year follow-up methods. So after 5 years, yung 13 patients were called to assess their periodontal health and possible presence of cervical tooth resorption. Pero 4 na patient lang yung bumalik. So clinical case number 1. So before, yung tooth color niya is A4. Then after ng 4th session ng tooth bleaching, naging A2 siya. Then after 5-year follow-up, yung shade pa rin niya is color A2. Tapos ito yung x-ray evaluation at 5 years follow-up. Case number 2. So before, yung shade ng ngipin niya is color A3. Then after niya ma-tooth bleach, naging A1 tsaka A2. Or after ng 5-year follow-up check-up niya, yung shade ng ngipin niya is naging A3. Hindi siya katulad dun sa clinical case number 1 na maayos yung pagkaka-tooth bleach niya. Kasi hindi nag-regress yung discoloration. Dahil kasi dito sa clinical case number 2, yung restoration niya is defective. And yun, kaya nagtuloy yung regression ng tooth discoloration.
So, yung sa first clinical case naman, na-preserve naman yung desired aesthetic color niya, even though yung patient reportedly occasionally drinking coffee and smoking. Pero yung final restoration made after the internal bleaching was in perfect condition. Hindi katulad nung sa second, third, and fourth clinical cases, where yung restorations nila ay defective tsaka regression ng dyschromias were observed. Although, in these cases, yung tatlong patients na yun reported the absence of habits like smoking and coffee consumption. Di katulad dun sa unang patient na na-preserve pa rin niya yung kulay ng ngipin niya kahit na umiinom siya ng coffee and nag-smoke. So, they have suggested that the internal tooth bleaching procedure would have to be repeated to maintain the desired aesthetic color.
So, discussion. The use of walking bleach technique for the management of discolored endodontically treated teeth can be safely done. Then, conclusion. In this follow-up study, yung 4 cases ng non-vital tooth bleaching were evaluated. And then, yung tooth discoloration niya tend to return after non-vital tooth bleaching. So, para nga ma-maintain yung kulay, the bleaching procedure must be repeated para makuha yung desired color niya. And when non-vital bleaching treatment is performed correctly, it can be used as an effective and safe post-endodontic treatment for discolored anterior teeth. The longevity of a non-vital bleaching is directly related siya sa quality of the final rehabilitation after the internal dental bleaching treatment, thus quality of patient care at home, tsaka yung patient's commitment to keep the follow-up appointments with the dental care provider.